So my presentation about syndromes affecting the sciatic and femoral nerves. So sciatic to pain refers to pain that travels along path of the sciatic nerve. As you see in the picture, the sciatic is going to be on the sciatic nerve. And the sciatic nerve travels from the lower back through the hips and buttocks and down each leg. Sciatica most often occurs when herniated disc or overgrowth of the bone pots pressure on part of the nerve. This causes inflammation, pain, and often some numbness in the affecting leg. Sciatic symptoms. Sciatic pain can be almost anywhere along the nerve pathway. It's especially likely to follow a path from low back to the buttock and the back of the thigh and calf. The pain can vary from a mild ache to sharp burning pain. Sometimes it can feel like a jolt or electric shock. It can worse when coughing or sneezing or staying a long time. Usually, sciatica affects only one side of the body. Some people can have numbness, tingling, or muscle weakness in the leg or foot. One part of the leg can be in pain while another part can feel numb. So about the diagnosis and tests, the diagnosis during the physical examination, a healthcare provider might check muscle strength and reflexes. Pain from sciatica, pain from sciatica will usually get worse while doing these movies. For example, you may be asked to walk on your toes or else rise from squatting position and lift your leg one at a time while lying on your back. So about tests, the tests can show us the sciatica. It's the simple one, X-ray, then EMG. It's electromyography and CT scan and MRI. What the femoral nerve syndrome? Femoral neuropathy or femoral nerve dysfunction occurs when you can't move or feel part of your leg because of damaged nerves, especially femoral nerve. This can result from injury, prolonged pressure on the nerve, or damage from this disease. In most cases, this condition will go away without treatment. However, medications and physical therapy may be necessary if symptoms don't improve. What causes of femoral neuropathy? So, can be the result of direct injury, tumor, or other growth blocking, trapping part your nerve. The prolonged pressure on the nerve, such a form of prolonged embolization, pelvic fracture, radiation to the pelvic, hemorrhage or bleeding into space behind the abdomen, which is called retroperitoneal space. A catheter placed into the femoral artery, which is necessary for certain surgical procedures. Diabetes may cause femoral neuropathy. Diabetes can cause widespread nerve damage due to fluctuations in blood sugar and blood pressure. Diagnosis femoral neuropathy, initial tests, and nerve condition. Nerve condition checks the speed of electrical impulse in your nerves. An abnormal response, such as slow time for electrical signals to travel through the nerves, usually indicates damage to the nerve in the questions. And third one, it's electromyography also on the MRI and CT scans. Thank you for your attention.